que estar a tu lado. Puedo reírme de ti, reírme de mí. Puedo ayudarte a buscar las soluciones a los problemas que causan dolores y hacer contigo casa cerrado.
Welcome to the PIUC, the Performance Indicator Update Court. Presiding judge is Health Maintenance.
Judge, we have several cases before the court today. In the first case, the defendant is Ms. Lippitt. The defendant has been sworn in.
Thank you, Bailiff Policy. Mr. PI update correct? Are you ready to proceed?
Yes, Your Honor. Mrs. Lippitt has failed to demonstrate an understanding of her dietary choices and how it affects her cholesterol and her LDL values. Her understanding of the suggested frequency of monitoring is also in question, because the last values we found were over 1 year old, Your Honor. We are also concerned with her understanding of the reportable abnormal results for her, Your Honor.
Your Honor, it is true my client has been feeling very sluggish lately. But she does inform me that she is knowledgeable of the information that Mr. Correct requests. So I'm asking, Your Honor, should my client approach?
Your Honor, it is true. It has been more than a year since I last reported my results. But I have the results you're requesting, and if I am able, I would like to provide them to you now. My lab work was done on February 10, 2013. My LDL was 101, slightly elevated. My total cholesterol was 210, also elevated. And my doctor knows about these elevated values. I understand that with my diabetic and ischemic vascular disease, timely update is important. And I will ensure that from now on, my LDL and cholesterol will be monitored annually as is requested.
This delay reflects poorly on her compliance with the rules. You have demonstrated a lack of understanding and knowledge of the frequency of monitoring. How do we know that you know where to document this information? How it can positively affect and impact the result of your LDL and cholesterol level?
I know that annual monitoring helps in my care management. I understand that lean meats, fresh fruits and vegetables, fatty fish, oats, whole grains, soy are important in my diet, and using vegetable oils instead of butter or lard are also important in my diet. And exercise helps to lower my cholesterol. I also know it's important to put the information in the right place. Let me show you.
I think we are satisfied, Miss Lippitt. Don't let me see you back here in my court again, or you will be cited for failure to comply. Your sentence will be fatty.
Your Honor, our next case for today is Miss HbA1c. The defendant has been sworn in.
Thank you, Bailiff. Mr. Correct. Miss A1C has been sweet enough to provide to the court the requested information and is respectfully requesting to pay the fine without further penalty.
Not so fast, Your Honor, not so fast. I have reviewed the results presented to this court today, Your Honor, and it's no wonder Mrs. A1C is standing here and smiling so sweetly. Her results were 11%. Her doctor will be notified and informed of the results because it is over 9%. We'll also request a referral for a nutritionist. There will be some medication adjustments for her as well, Your Honor. We, the people, recommend the following plan of care changes for the Mrs. A1C. She must repeat her A1C every 3 to 4 months. She must return to this court to be re-evaluated in response to the imposed changes, and we will check in the documentation and PCRS if the data is in the right place, Your Honor.
Your Honor, my client agrees to the terms.
So ordered. Mrs. A1C, prolonged elevation of your blood glucose level can result in irreversible damage to your kidneys, heart, vascular system, nerves, and eyes. I hope this intervention is enough to change your behavior. Complying with your diet, exercise, and medications and keeping your medical appointments will keep your smile sweet for years to come.
Your Honor, the next case before you today is Ms. Colorectal Screen. The defendant has been sworn in.
Thank you, Bailiff Policy.
Your Honor, Mrs. Colorectal Screen has several cohorts and we have issues with all of them. I think all of them should be entered into this adjudication, Your Honor.
Bailiff Policy, please hand me that document. Thank you, Bailiff Policy. Miss Nurse, I'm doing the best I can. Do you need an adjournment to summon all of your clients?
No, Your Honor. They're here and they're all prepared.
Miss Colorectal Screen, Miss Colonoscopy, Miss Sigmoidoscopy, Miss Fecal Occult Blood Test. Would you stand, please? Miss Colorectal Screen, are you prepared to have your case heard today?
Yes, Your Honor. We have started our preparation yesterday, and fecal occult blood test was sent to the lab 2 days ago. We are awaiting the results.
Okay, Your Honor, we will not pursue this case any further at this time. Ms. Colonoscopy is obviously in compliance as she is 60 years old, and our investigation revealed that her last exam was done 10 years ago, and it was normal. She's also demonstrated to the court by her documentation that she's aware and will follow up with the following recommendations by the doctor. Every 5 years, she will do a sigmoidoscopy. Every 10 years, she will do a colonoscopy. And every year, she will do a fecal occult blood test at the discretion of her doctor. Our investigation also found these essential critical values are also in the right place, Your Honor.
Case dismissed. Miss Colorectal Screen, you are free to go.
Judge, the next case on the docket is Miss Status Post, Hospital Discharge, MD Appointment. The defendant is not in the courtroom.
Thank you, Bailiff Policy.
My client is currently at her doctor's appointment, status post hospitalization. Today is her 10th day at home. Her home health aide is at the appointment with her, and we have her daughter here who could testify if needs be.
Please have the defendant's witness stand. Miss My Mother Needs, have you been sworn in?
Yes, Your Honor. I have been sworn in to tell the truth and nothing but the truth. Your Honor, my mother needs 2 more home health hours.
Miss My Mother Needs, please wait for the question.
Sorry, Your Honor.
Mr. P.I. update correct. Do you have any questions for this witness, Miss My Mother Needs?
Yes, Your Honor. My only question for the witness at this time, Your Honor, if my mother needs, if she could send us documentation from her doctor saying that her post-hospitalization appointment was kept. We would like to have the name of the doctor and the telephone number. It also appears that they are well within the 14-day requirement post-hospitalization, Your Honor. We will check PCRS to see if the documentation is in the right place, it's in the COC. That will be all, Your Honor.
We will adjourn this case pending the requested documentation. With regard to the increase in home health hours, it will be evaluated by the nurse at the appropriate time. That will be all for now, Miss My Mother Needs.
Your Honor, the next case before you today is Miss Where Am I? The defendant is not in the courtroom, Your Honor.
Nurse, I'm doing the best I can. Where is your client?
Your Honor, she became a little confused and said she was going to bed. Her home health aide, the best home health aide in Manhattan, is with her. I just sent for them. Could you give us a minute?
You have 1 minute.
Your Honor, this defendant does not appear to be able to testify, Your Honor.
Your Honor, Mrs. Where Am I is having a bad day today. Her witness, the best home health aide in Manhattan, can corroborate the precautions we have in place.
Mr. P.I. update correct. Do you want to cross-examine the defendant's witness?
Yes, Your Honor, I will. Miss Manhattan, can you tell me what measures are in place to prevent wandering out of the home for this patient and maintain safety due to the decreased vision of your patient?
Oh yes, the nurse had the therapist visit and evaluated Mrs. Where I Am, and she was given a safety equipment for the bathroom, a rollator, and a commode. Be quiet. We also have a home exercise plan. The social worker visited and got my patient a safety term bracelet, a door alarm, a lock on the door which is out of her reach. It's okay, it's okay. We also took the social worker's advice and put a black hoarding in front of the door. The home is well lit and there's a night light also. We have removed all throw rugs. There is no clutter in the walkways in the home. The home is well lit and there's a night light, so Mrs. Where Am I can use the commode safely at night. My patient is seen by the psychiatrist monthly and he checks if her medications remain effective. Whenever the nurse visits, she checks on all of these things. The nurse also asks when Mrs. Where Am I has had her eyes checked and if she needs an appointment, the nurse calls to make the appointment. If there are any changes in Mrs. Where Am I mental status, like looking for something or someone, or increased anxiety or aggressive behavior, I understand to notify the nurse and the MD as soon as possible.
Your Honor, the documentation supports the member is having her vision screen done annually. The nurse documents in the narrative every visit on the dementia plan. The patient has not had any episodes of wandering in the last 2 years.
Your Honor, we've seen the documentation and at this time we would like to withdraw our complaint. Nonetheless, we reserve the right to call the defendant back to testify again in case there are any episodes of wandering.
Case dismissed without prejudice.
Today's next case is now arriving, Your Honor. The CHF has already been sworn in.
Thank you, Bailiff Policy. Mr. P.I. update correct. Make your case, please.
Okay. Your Honor, Ms. CHF, you see, seems to be easily fatigued and breathless, as you can see. Can you tell me what your weight and symptoms have been over the last 2 weeks?
My weight today is 128, and the range in the last 7 days is 123 to 128. I have a swollen foot, and I could hardly sleep. I use 3 pillows instead of 1, and I have shortness of breath if I walk a few feet. I already informed my nurse about it.
Your Honor, we have been in touch with Mrs. CHF's primary doctor, and an appointment has been made for tomorrow. The doctor increased her diuretic. The patient started the increased dose today. The member is aware of the importance of keeping her appointment with the doctor.
Your Honor, I'm not satisfied with this defendant's status. As you can see, she's coughing very much in this courtroom. I want to see the results of the member's weight for the next 2 weeks, Your Honor. And I want to be informed of any changes in her medications as a result of a doctor's visit. I will also review the records and expect the weight range to be in the right place, which is the narrative of the COC. Your Honor, I will also send documentation to you.
Nurse, I'm doing the best I can. Have your client comply with the prosecutor's request. We will see you back here in 2 weeks.
Your Honor, the last case on the docket for today is not in the court. We have not been able to locate that.
Nurse, I'm doing the best I can. Where is your client, Mr. and Mrs. Flu and Pneumonia?
Your Honor, I am unable to reach them.
Your Honor, we filed our investigator follow a lead we obtained, and we believe Mr. and Mrs. Flu and Pneumonia fled the area early and are currently in Florida, Your Honor. May I have my PI, private investigator, address the court, Your Honor?
Yes.
Your Honor, we found the defendants. They are in Florida. We know they're going to be back by October.
Your Honor, we have tried to contact Dr. I ain't got time for that, to obtain the required documentation. The doctor has not returned my several attempts at trying to reach her, has not returned one phone call or written request. We have had to subpoena her to compel her to appear, Your Honor.
Doctor, I ain't got time for that. Please
Just
stand.
had no time for this. Oh. Yes, Your Honor. I get calls all day from this nurse, that nurse, from visiting nurse services of New York, from VNS Choice, and I can't just take all these calls regarding all my patients. In regards to Mr. and Mrs. Flu and Pneumonia, they were given their vaccines. Flu was given in September 1st, 2012, and pneumonia was given in August. Flu was told that she needed to come back in October to be vaccinated for this year, and he was informed that this vaccination is required yearly. And Pneumonia understands that she doesn't have to return until she turns 65, and she's now 55. Your Honor.
Your Honor, we are grateful for Dr. Angle time for that, for appearing here today. But that does not remove the legal responsibility of the defendant, Your Honor. Mr. and Mrs. Flu and Pneumonia must present evidence of immunization compliance to the court, Your Honor.
We will enter a bench warrant for Mr. and Mrs. Flu and Pneumonia. When they return, we will have them picked up and a vaccine ready.
Obtaining PI data has been successful by partnering with the family, the caregiver, the member, the home health aide, and the healthcare team. As you know, we have several tools that assist us with doing this job, and they include the following: the prevention and screening form, the interim order, and the PI tracking tool in SharePoint. In 2013, all care managers are using the PI tracking tool. It is also key that we put the data in the right place, and this will help you all go green.
Go green!